Hey everyone, before we dive in, a quick note, this video is for general education only and isn't medical advice. Always talk with your healthcare professional about what's right for your specific situation. Now, if you're considering tirzepatide or already taking it, you might have heard some concerns about thyroid nodules and cancer risk. Let's break down what the research actually shows and what you need to know. Tirzepatide is a medication approved for type 2 diabetes and weight management. It works by activating two hormone receptors in your body that help control blood sugar and appetite. But there's been some buzz about thyroid concerns, so let's talk about what the evidence really says. The FDA includes a boxed warning on tirzepatide about potential thyroid C-cell tumors. This warning exists because studies in rodents showed these animals developed thyroid tumors when given the medication. That sounds pretty alarming, right? But here's the important part. Clinical trials involving over 10,000 people taking tirzepatide for up to about 2 years showed no increased risk of thyroid cancer or thyroid nodules compared to people taking placebo. So while rodents had problems, humans in these studies did not. Now, does this mean the risk is absolutely zero? Not quite. It means that in the research we have so far, we haven't seen the same pattern in humans that we saw in animals. These trials weren't specifically designed to detect very rare cancers, and we're still learning about longer-term effects beyond 2 years. But based on current evidence, the human data is reassuring. That's why the warning exists out of caution, but it's also why your doctor can still prescribe this medication when it's appropriate for you. There are some people who absolutely should not take tirzepatide if you have a personal history of medullary thyroid carcinoma. That's a specific type of thyroid cancer. You should not take this medication. The same goes if you have a family history of this cancer. There's also a rare genetic condition called multiple endocrine neoplasia syndrome type 2, or MEN2. If you or your family members have this, tirzepatide is not safe for you. If you're not sure about your family history, this is definitely something to discuss with your doctor before starting treatment. It's worth having that conversation to make sure tirzepatide is the right choice for your situation. For most people taking tirzepatide, routine thyroid monitoring isn't necessary. Research suggests that regular calcitonin screening or thyroid ultrasounds aren't recommended unless you have specific risk factors. Your healthcare provider will determine if you need any special monitoring based on your individual health history. That said, you should know what symptoms to watch for. If you develop a lump or swelling in your neck, difficulty swallowing, or persistent hoarseness that doesn't go away, contact your doctor promptly. These symptoms could indicate a thyroid issue and should be evaluated. They're not necessarily related to the medication, but they're definitely worth checking out. When you talk to your healthcare provider about tirzepatide, come prepared with your family medical history, especially anything related to thyroid cancer. Ask whether tirzepatide is appropriate given your personal and family history. If you're already taking the medication, make sure you know what symptoms should prompt you to call your doctor. Your healthcare provider can help you weigh the benefits of tirzepatide against any potential risks specific to your situation. Every medication decision is personal, and what's right for one person might not be right for another. So here's what to remember. Tirzepatide has an FDA warning based on animal studies, but clinical trials in humans haven't shown increased thyroid cancer or nodule risk over about 2 years of treatment. While very rare risks and longer-term effects can't be completely ruled out yet, current evidence is reassuring. The medication should not be used if you have a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, and you should report any neck lumps, swallowing difficulty, or persistent hoarseness to your doctor for evaluation. Remember, this information is meant to help you have informed conversations with your healthcare provider, not to replace their advice. Always consult your doctor about your specific medical situation. What questions do you have about tirzepatide and thyroid health? Drop them in the comments below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.